Good evening, ladies and gentlemen. On behalf of the Faculty of Medical Sciences, University of Sri Jayawardenepura, I warmly welcome you to the International Conference on Health Sciences 2021. We really appreciate you taking the time off to be with us amidst your busy schedule. Today, we have some distinguished guests lined up to educate you, and we really hope that you learn something today. Ladies and gentlemen, researchers and scholars, we all know research and innovation are pivotal when it comes to solve the challenges faced in the world today. Under this year's theme, Exploring Challenges to Make a Difference, let us now look into the authors who have been selected to deliver their oral presentations with regards to their research findings.
Thank you for joining with this presentation. I am Dr. Damitha Gunawardena from University of Peradeniya. My paper is on trends in cancer incidence and mortality in Sri Lanka from 2005 to 2015. When we consider the global cancer burden based on 2020 estimates, there were 19.3 million cases and 10 million deaths. This 19.3 million projected to be increased up to 28.4 million cases by 2040. That would be 47% increase in cancer incidence. When we talk about incidence and death rate by sex, incidence rate was 19% higher in men than in women. Death rate was 43% lower in women than in men. There were 10 million cases and 5.5 million deaths among men and 9.2 million and 4.5 million deaths among women. When we talk about cancer and SDGs, the cancer prevention is related to SDG target 3.4, which is reduced by 1/3 premature mortality from NCDs through prevention and treatment. For every 10 persons who die prematurely of NCDs, 3 die of cancer. So without preventing cancer deaths, none of would be able to achieve this SDG target. The analysis of epidemiological data on cancer is an essential tool to evaluate all cancer control activities in a country. With that background, aim of this analysis is to determine trends in cancer incidence and mortality in Sri Lanka from 2005 to 2015. National cancer mortality data between 2005 and 2014 and cancer incidence data from 2005 and 2015 were obtained from the published data of the National Cancer Control Program and Department of Census and Statistics. Joint point regression analysis was performed to examine the trends in crude death rate of cancer mortality and age standardized rates of cancer incidence. Trend and annual percent change of incidence and mortality with corresponding 95% confidence intervals were calculated by using Joint Point Regression Program version 4900. These are the parameters which we have used in the model development. Annual percent change is one way of characterize trends in event rates over time. Find the joint point model that best fits the data allows us to determine how long annual percent change remained constant and when it changed. When it comes to the results, the total of 207,670 cancer patients were diagnosed from 2005 to 2015, and nearly 150,000 died due to cancer during the same period. Cancer mortality in Sri Lanka increased from 2005 to 2014 with an annual percentage change of 3.19%, and there were no joint points identified for this model. Sex-specific trends shows an APC of 3.8% for men and APC of 2.4% for women. And for both these models, there were no joint points. Trends in age standardized rates of cancer incidence between 2005 and 2015 significantly increased with an APC of 4.83%, and no joint points identified for this model as well. And cancer incidence in men increased with APC of 6%, while women with an APC of 4%, and both these models are zero joint points models. In summary, for mortality models overall, the overall APC was 3.19%. For men, it was 3.8%, and for women, it was 2.4%. And when it comes to the incidence, APC for overall, it was 4.83%, and for men, it's 6%, and for women, it's 4%. In conclusion, during the study period, there was significant increasing trend in cancer mortality and incidence in Sri Lanka. Increasing trends in mortality and incidence of cancer were higher among men compared to women. These are my references, and that concludes my presentation, and thank you for your attention.
Ladies and gentlemen, I am here today to present the research finding of the study titled The Effect of Body Mass Index on Lung Function of Sinhala School-Aged Children in the Colombo District, Sri Lanka. I am D.M.D. Seneviratna, postgraduate student of Faculty of Graduate Studies of University of Sri Jayawardhanapura. Let me begin by giving a brief introduction to the study. The relationship between BMI and lung function test may vary with age, race, geographical region, and also with the different obesity standards that are used. According to the available literature, only few studies have examined the relationship between BMI and lung function among children. In fact, the findings of the studies are inconsistent. When it comes to Sri Lanka, a study among older children between age 8 to 16 years has reported an absence of a significant difference in lung function values among overweight, obese, and normal weight group. But the relationship between BMI and lung function has not been reported previously in the age group 5 to 7 years old in Sri Lanka. Therefore, our objective was to evaluate the effect of body mass index on lung functions of 5 to 7 years old children in Colombo District, Sri Lanka. With regards to the methodology, this descriptive cross-sectional study was conducted among school children aged 5 to 7 years from the Colombo District. Sample size was calculated using a standard formula for that expected proportion, at least one acceptable maneuver taken as 82.3% with a level of precision 0.05 and confidence interval of 95%. Non-response rate taken as 10%. Sampling method was stratified random sampling. Ethical approval for the study was obtained from the Ethics Review Committee, Faculty of Medical Sciences, University of Sri Jayawardhanapura. Data collection was done by means of questionnaire, anthropometric measurements, and the spirometry test. A pre-tested self-administered questionnaire was used to assess the presence of underlying respiratory diseases, which was completed by the parent or guardian of the child. Demographic data, general health were assessed. Based on that, healthy children were recruited in the study. Weight and height measured as anthropometric measurements. The spirometry procedure was followed American Thoracic Society guidelines, and the spirometry recordings that were acceptable and reproducible were included in the analysis. For the BMI category, we define it according to the WHO standards for the children 5 to 19 years age group. Data analysis was performed using Statistical Package for Social Sciences version 23. The findings of the study was presented by means of descriptive statistics, and correlation was analyzed by Spearman correlation coefficient. T-test, one-way ANOVA test were employed to compare male-female groups and BMI groups. Multivariate analysis was done by linear regression. The significant level was predetermined at p-value less than 0.05. Let me now present the findings of the study. There were 60% of males out of the total sample of 234 healthy children. This table lists means of age, height and weight. And males were found to be significantly higher values for the height and weight when compared to female group. The table shows here percentage of participant in each category. The figure further illustrates that majority of the sample consisted with normal BMI category. Means and standard deviations for some lung function parameters are listed here, and male group had significantly higher lung function parameters when compared to female group. Taking BMI as a continuous variable, we did the Spearman correlation, and we found out that the significantly positive correlation with BMI in both male and female group. We also compared lung function parameters with BMI groups by one-way ANOVA test. FEV1 parameter was significantly different between the three groups. Similarly, FVC parameter was compared among BMI groups, and again it was found out that the statistically significant difference for the FVC between BMI groups. Subsequently, we evaluated predictors of lung function parameters. First, we have taken FVC and we analyzed the predictors with multivariate linear regression, and we found out that age, gender and BMI are significant predictors of FVC parameter. Then we took FEV1 as the dependent variable. Similarly, age, gender and BMI were significant predictors for FEV1 parameter. And these are the prediction equations that we derived from the multivariate regression. So adjusted R-square was 31% for FEV1 and 32% for FVC parameter. In conclusion, BMI was a significant independent predictor of lung function values. 1 point decrease in BMI reduced the FVC or FEV1 by 0.03 liters per minute. Findings of the current study shows age and gender as the other predictors of the lung function values. So these are our strengths and limitations. One of our strengths that we evaluated lung function parameters among very young children, which studies are not very much available in literature globally. However, as one of limitation, since it was a cross-sectional study that cannot delineate cause and effect, therefore longitudinal study is recommended for further confirmation of the findings. The other limitation was low muscle mass might have been the reasons for low lung function parameters among the underweight children, since we measured BMI and we could not evaluate skeletal muscle mass or fat-free mass separately. Therefore, to confirm our findings, further studies are recommended to evaluate the link between muscle mass and lung function parameters in children. Finally, we would greatly acknowledge all the children who participated in the study and the technical assistant for their contribution. Thank you very much for your attention.
Good morning. I am Siddharth Pereira, and it is my pleasure to present our undergraduate research today. And I would like to thank the International Conference on Health Sciences for granting us this opportunity. Our research topic is obstetric and neonatal factors influencing the development of childhood asthma as evidence from children aged 3 to 10 years attending tertiary care hospitals in Colombo district, Sri Lanka. This is the outline of our presentation. Asthma is one of the commonest chronic diseases of childhood and is associated with significant morbidity and economic cost worldwide. It is also considered to be one of the commonest reasons for school absenteeism. The prevalence of childhood asthma is increasing all over the world, and according to previous studies conducted in Sri Lanka, the prevalence was found out to be 22.6%. Childhood asthma has a multifactorial etiology with genetic and environmental components. Emerging theories suggest that fetal and perinatal exposures are thought to have a role in the development of chronic diseases. Factors such as gestational diabetes mellitus and hypothyroidism have been studied in relation to childhood diseases, especially with regard to asthma. Neonatal factors, including anthropometric measures at birth, are used as indicators of outcomes of perinatal programming. Hence, it is important that we study the associations between childhood asthma and such factors. Our objectives were to determine the proportion of childhood asthma and its association with selected obstetric and neonatal factors in children aged 3 to 10 years in tertiary care hospitals in Colombo district, Sri Lanka. We used a cross-sectional analytical study with pediatric clinics and wards of Colombo South Teaching Hospital and Lady Ridgeway Hospital as our study settings. Our study population consisted of 266 children aged 3 to 10 years accompanied by their mothers. We excluded children who were not accompanied by their mothers and who had multiple comorbidities and congenital disorders, and those who did not have the child health development record in their possession. The sample size was calculated using the standard formula, where the prevalence was in reference to a study conducted in Kampala district in 2009. We used a systematic sampling method for clinic and ward settings, where data was collected from every other child. We used an interviewer-administered questionnaire along with GINA severity and control assessment as a part of it. Clinician diagnosis of childhood asthma and the respective medical records were used, and information regarding neonatal factors were taken from the CHDR. Our study variables were categorized into 4 main areas, namely socio-demographic factors, including sex of the child, ethnicity of the child, and age of the child. Neonatal factors, including birth weight, birth length, occipitofrontal circumference at birth, and period of gestation. Obstetric factors, including mode of delivery, maternal hypothyroidism, maternal age at delivery, diabetes mellitus exposure in utero, and gestational diabetes mellitus. Asthma-related factors, including family history, severity and control, and age of onset. Data was analyzed using the SPSS software, where bivariate analysis using chi-square test and 2-sample t-test were used to assess the significance, and a p-value of less than 0.05 was taken as significant. The results revealed the following. 29.7% of the study population was found to have clinician-diagnosed childhood asthma. A similar percentage of children diagnosed with childhood asthma was seen across gender, different age groups, and different ethnicities as shown in this graph. A majority of children diagnosed with childhood asthma had an age of onset of equal to or less than 4 years of age and well-controlled disease. Majority belong to step 2 category of severity according to GINA assessment. These tables show the distribution of children with and without childhood asthma across different variables. Analysis of these variables revealed that advanced maternal age, maternal hypothyroidism, diabetes mellitus exposure in utero, gestational diabetes mellitus, family history, along with birth length, were statistically significant. Thus, accordingly, these findings were in line with the previous literature, and these findings were inconsistent with previous literature. However, the birth length had not been studied previously. Thus, we conclude that childhood asthma is significantly associated with gestational diabetes mellitus, exposure to diabetes mellitus in utero, advanced maternal age, maternal hypothyroidism, and birth length. However, the demographic variables were not seen to be significantly associated. We recommend that the healthcare system should be made aware of these factors associated with childhood asthma, and routine follow-up of such children must be undertaken, as it could lead to early detection and initiation of treatment at an early stage. These factors should be addressed by the healthcare planners and policymakers on maternal and child health in Sri Lanka. Also, further extensive research should be carried out to validate these findings with an aim of reducing the global burden of childhood asthma. Thank you.
I am Yashodhavina Silva from University of Sri Jayawardhanapura. The title of my presentation is Gastric Microbiota and its Association with Gastric Pathology among Dyspeptic Patients in a Tertiary Care Hospital, Sri Lanka. Dyspepsia refers to a group of upper gastrointestinal symptoms which is a common clinical presentation for seeking healthcare worldwide. Helicobacter pylori is one of the major pathogens found in stomach, and it may cause the gastric inflammatory changes within the gastric mucosa, which may lead to a dyspeptic symptom. However, the global Helicobacter pylori prevalence has declined over the past few years. Even in Sri Lanka, the prevalence has reduced from 70% to 16%. Even with this low prevalence of Helicobacter pylori, a considerable number of patients are still complaining about dyspepsia. With the development of culture-independent advanced molecular technique, it was possible to discover the other microorganisms in the human stomach. Therefore, it is important to investigate the possible role of other microorganisms in gastric pathology. This descriptive cross-sectional study was carried out among 159 dyspeptic patients who attended to the endoscopy clinic at Colombo South Teaching Hospital. Ethical approval was obtained from the Ethics Review Committee of University of Sri Jayawardhanapura and Ethical Committee of Colombo South Teaching Hospital. We included the patients above 18 years of age, both male and female patients with any combination of these dyspeptic symptoms. And also we have excluded the patients who are less than 18 years of age, mentally unstable, and patients who have taken antibiotic during 1 month period before the endoscopy. After obtaining an informed written consent, 3 antral gastric biopsies were collected from each patient for in-house biopsy urease test, histology, and PCR. In-house biopsy urease test is a rapid test which is used to detect the Helicobacter pylori in gastric mucosal biopsies. Histopathological assessment was done by a consultant histopathologist according to the updated Sydney classification system. PCR amplification of bacterial DNA was done using previously published universal primer set HDA1 and HDA2, and for the yeast DNA amplification, NL1 and LS2 primer set was used. The amplified PCR products were subjected to agarose gel electrophoresis for visualize the presence or absence of bands.
DGG is a molecular fingerprinting technique which is used to separate the mixture of DNA fragments according to their melting characteristics. This method is commonly used to analyze the complex microbial composition to identify the diversity. In this method, amplified PCR products are subjected to gel electrophoresis on a polyacrylamide gel which contains a linear increasing gradient of denaturance. When a DNA reaches to its optimum denaturing concentration, it will reduce the mobility of the DNA molecule. Different sequences will stop migrating at different positions of the gel. This can be visualized using the ethidium bromide. In DGG analysis, the generated banding pattern is considered as an image of the whole bacterial community. Out of the 159 dyspeptic patients, 83 were male and 76 were female, and 26 patients were positive for Helicobacter pylori and 28 patients had gastric ulcers. Upon analysis of dyspeptic symptoms, abdominal pain was the most predominant dyspeptic symptom. According to the histopathological findings, mild chronic gastritis was the most predominant finding, while active chronic gastritis was seen in 29 patients and normal gastric mucosa were detected in 8 patients. Out of the 159 dyspeptic patients, 149 specimens gave positive results for eubacterial PCR, while only 10 specimens were positive for yeast DNA. Among the bacterial DNA positive patients, majority were presented with mild chronic gastritis, and out of the 10 yeast positive patients, 6 had active chronic gastritis with moderate severity. This is a representative DGG gel image. Each lane indicates a single specimen and each band was considered as a single microbial species. A total of 1,238 bands were identified from 149 specimens. However, a broad range of DGG bands were visualized and suggesting a diverse microbial community within the gastric mucosa. The comparison of number of bacterial species among the patients with active chronic gastritis, mild chronic gastritis and normal gastric mucosa showed that the mean number of bacterial species were reduced with the increasing severity of gastric pathology. Cluster analysis of bacterial DGG profiles. This is a statistical method of processing data into the clusters based on the band similarities between the DGG banding patterns. According to the cluster analysis, 3 main clusters were identified with 12 outliers. Cluster A had a similarity of 31%, Cluster B had a similarity of 39%, and Cluster C had a similarity of 41%. Higher proportion of active chronic gastritis patients were included in cluster A, which indicate that the patients in this A cluster had similar microbial diversity. And majority of the mild chronic gastritis patients were included in cluster C, indicating patients in this cluster had 41% similarity in their gastric microbiota. Also, highest microbial diversity was observed in cluster C compared to the cluster A and B. Although the prevalence of Helicobacter pylori was low, still majority of the patients had gastric pathology. This suggests that the possible role of other microorganisms in causing gastric pathology. The study reports the presence of bacteria and yeast species in the gastric mucosa. Majority of the yeast positive patients had active chronic gastritis, which may have a contributed role in gastric pathology. Bacterial DGG profiles indicate a relatively diverse microbial pattern, and this study demonstrated the number of bacterial species were reduced with the increasing severity of gastric pathology. Therefore, we can conclude that the presence of yeast species in the gastric biopsy suggesting a possible role in gastric pathology. The bacterial DGG profiles indicate a relatively diverse microbial pattern suggesting a presence of multiple bacterial species within the gastric mucosa. These are some of my references. And I would like to acknowledge a university research grant for their financial support and patients who gave their consent and participated in this study. Also, I would be very thankful for all staff members of endoscopic unit at Colombo South Teaching Hospital, Department of Microbiology and Department of Pathology of University of Sri Jayawardenepura. Thank you.
Good morning, ladies and gentlemen. The research I am presenting today is on patterns and predictors of postpartum weight retention in Kampala district. Maternal obesity, excessive gestational weight gain, and postpartum weight retention constitute a new public health challenge among women as well as children in Sri Lanka. The postpartum weight retention is defined as the difference between weight at the time after delivery and weight prior to pregnancy. As example, postpartum weight retention in 6 months postpartum is the difference between weight at 6 months postpartum and pre-pregnancy weight. As we all know, our country has impressive achievements in reducing maternal and infant mortality and controlling or eliminating communicable diseases. The malnutrition and low birth weight deliveries also have been reduced to low levels. But during our clinical training, we have noticed that some mothers tend to become obese and overweight after delivery of their babies, which might result in many adverse outcomes as obesity increased risk of non-communicable diseases like diabetes mellitus and hypertension. And also obesity can lead to distress to women due to negative thought about their body image. All of these factors give rise to negative influence to quality of life. So we thought it is important to conduct a research to determine patterns and identify associated factors of postpartum weight retention, as we could not find any data related to this in Sri Lanka. We believe that knowing the current situation is an important step tackling any health problems. The general objective of our research was to describe the patterns of postpartum weight retention and factors associated with it among postpartum mothers bringing their children aged 6, 12, or 18 months to immunization clinics in Kampala district. We also look at the association of age, parity, pre-pregnancy weight, body mass index, pregnancy weight gain, mode of delivery, and postpartum contraceptive practices with postpartum weight retention. The study was conducted after obtaining ethical approval from Ethics Review Committee, Faculty of Medicine, University of California. This was a descriptive cross-sectional study. Using consecutive sampling technique, we have selected mothers who brought their children 6, 12, and 18 months vaccination from each postpartum period. We needed 140, total of 420 women. We selected MOH vaccination clinics in Kampala district. The clinics were selected considering the required sample size and number of children attend to the clinics. Period of data collection was from 25th of November to 3rd of December in 2019 and 3rd of March to 10th of March in 2020, which were 2 weeks period. Factual clinical information was collected using an interview schedule in English and the interview was conducted in Sinhala. Additional information extracted from maternal pregnancy record. This was done as face-to-face interview and by the check-in 11 antenatal records. The data was analyzed using R software. Descriptive statistics were presented as mean and standard deviation. The t-test, correlation, and linear regression was used to identify factors associated with postpartum weight retention. After excluding some data according to our exclusion criteria, there were a total of 412 women participated in our research. In this table, we have illustrated the distribution of background variables and postpartum weight retention by postpartum months. The mean postpartum weight retention was 4.4 kg, 95 confidence interval 3.8 to 5. This shows in this 3 postpartum months period, participants in 3 postpartum months had similar background characteristics. The distribution of age, pre-pregnancy weight, and pre-pregnancy BMI were almost identical in 3 groups. The first box plot, it indicates the relationship between maternal age and postpartum weight retention. The maximum postpartum weight retention is observed in 18 to 25 age group. The second box plot, it indicates the relationship between parity and postpartum weight retention. The greater postpartum weight retention is in primary parity women than the multiparity women. Here you can see in this scatter plot, the postpartum weight retention was inversely associated with pre-pregnancy weight. And this second scatter plot also, the postpartum weight retention was inversely associated with pre-pregnancy BMI. Here in this scatter plot, we have illustrated the relationship between pregnancy weight gain and postpartum weight retention. Here, the postpartum weight retention was positively associated with pregnancy weight gain. The data was further explored to assess the variation in postpartum weight retention by mode of delivery and postpartum weight retention by contraceptive method used in postpartum period. There was almost no difference in postpartum weight retention between women who underwent cesarean delivery and women who underwent vaginal delivery. But the mean postpartum weight retention was 0.03 kilogram higher women who underwent vaginal delivery, but this difference is not statistically significant. And here, mean postpartum weight retention was 0.92 kilogram higher women who used hormonal contraceptive methods during postpartum period than the non-users. But this difference also not statistically significant. According to our results, it is concluded that the magnitude of postpartum weight retention is uniformly high at 6, 12, and 18 postpartum months. The mean postpartum weight retention was 4.4 kilogram. 95 confident interval 3.8 to 5. There was a moderate correlation between pregnancy weight gain and postpartum weight retention. Ladies and gentlemen, these results indicate that effort to control overweight and obesity epidemic among women should use pregnancy and postpartum period as entry point for the interventions. Evidence-based interventions for the promotion of healthy body weight in women of childbearing age and prevention of excessive weight gain in pregnancy should be conducted. Thank you.
Today I'm presenting a study on does mindfulness affect coping responses, COVID-19 lockdown experiences among adolescents. The global pandemic of COVID-19 has led to mass quarantine of communities around the world. These measures have created heavy psychological and emotional problems for some people. Research shows that children and youth who were quarantined during pandemics were more likely to develop acute and post-traumatic psychological disturbances. Mindfulness is the awareness emerges through paying attention to purpose in the present moment. When practiced regularly, mindfulness improves mental health and well-being and the ability to respond to everyday stresses. As such, mindfulness as a skill has been recognized in recent years and it is now widely practiced in educational settings around the world. Satipasala in Sri Lanka aims to introduce mindfulness practice to school children. The program is conducted every weekly in several centers in the island and teaches mindfulness as a wholesome life skill. This research explores the association of mindfulness practice on coping strategies during the COVID-19 lockdown among adolescents. The research aims to compare the experiences during lockdown days among adolescents who attend Satipasala and those who do not attend Satipasala. This qualitative study was conducted from May 2020 to July 2020 during a phase of lockdown due to the first wave of COVID-19. A convenient sampling was used to recruit participants between ages 15 and 17 years by sending an e-flyer through web-based forums including Satipasala Web. Group A composed of 10 adolescents who attend Satipasala regularly for at least 6 months, while Group B composed of another 10 who has not attended Satipasala at any stage of their lives. At this point, I would like to emphasize that qualitative research scrutinizes the dynamic qualities of a situation rather than elucidating the proportionate relationships among its constituents. An electronic semi-structured questionnaire containing open-ended questions relating to the knowledge about COVID-19, experiences during lockdown, inspirations, challenges, coping strategies was provided to participants and they submitted detailed written narratives. We analyzed data using reflexive thematic analysis. There was an almost equal representation of male and female in each group. data were deemed saturated as there was no new information received towards the latter part of the study. The duration of regular attendance to Satipathala varied from 6 months to 4 years among Group A, and 80% of them have been attending Satipathala for more than 2 years. All participants were living at their homes during the lockdown period. We developed 3 overarching themes, namely challenges, coping responses, and emotional status, that represented the perceptions of the study participants. Under the theme challenges, majority of the adolescents in both groups felt prohibition to go out and meet friends and relatives as a challenge. Many missed being able to meet friends and showed great interest in socialization. Non-attendees of Satipathala further described educational and household issues as challenges. Although there were perceived challenges, all participants demonstrated significant psychological resilience. They showed the ability to understand the global crisis, accept the circumstances, and employ proactive coping mechanisms. All adolescents were engaged in indoor and outdoor activities as coping strategies. The imperative difference was noted in the realm of emotional status. Freedom from time-pressured routines was immensely appreciated by all participants. However, analyzing subtle emotional articulations through their text, we observed that Satipathala attendees had expressed more positive attitudes, while non-attendees of Satipathala expressed variable attitudes. Importantly, that non-attendees of Satipathala stated that they make effort to be happy, while Satipathala attendees felt that they are happy anyway. To discuss emotional state further, let me show some quotes from participants. Participants expressed the value of freedom they have during the lockdown to slow down and enjoy little moments in life. I quote, "I feel free and relaxed. I was longing for a change. Hope this freeness continues." I unquote. Satipathala attendees showed positive attitudes. They showed the ability to be attentive and thoughtful. I quote, "We are all in this together. Helping others in need is important. We shared what we have." I unquote. However, nearly half of non-attendees of Satipathala reported boredom, monotony, sadness, and uncertainty with the extension of lockdown. I quote, "At first it was okay, but after about a month, it was boring as we had to do same things repeatedly." I unquote. Almost all adolescents in Group A expressed that they were happy anyway. Practicing mindfulness was conducive to helping them overcome the difficult and critical situation. I quote, "I'm happy. Spending the day mindfully reinforces happiness." I unquote. On the contrary, we observed that non-Satipathala attendees made effort to be happy, and many of them have perceived happiness through activities associating with others. I quote, "I do try to be happy all the time. My friends help me a lot to be happy." I unquote. In conclusion, we would like to say that findings of this study shed light on emotional impact of lockdown, concerns it has raised for adolescents, and ways they have been coping. Mindfulness practice may facilitate positive attitudes and effortless happiness for adolescents in distressful conditions such as COVID-19 pandemic. We express sincere gratitude to Most Venerable Dhammajiva Thero, and we sincerely thank all our participants. These are some of the references that we looked in for this study. And thank you.
Hello everyone, I'm DM Bendragamma, presenting a research on the importance of public perception on the genetic link between parents and the offspring in the determination of attitudes towards surrogacy. Surrogacy or surrogate motherhood is an assisted reproduction method in which a woman consents to become pregnant for the purpose of gestating and giving birth to a child to be raised by another person or couple, commonly referred to as the intended or commissioning parents. With the advent of assisted reproductive technologies, surrogacy has become an important fertility treatment, making motherhood possible for women with many types of pathological conditions. With regards to surrogacy, two main categories can be seen, namely traditional and gestational, in which the gestating woman intends to relinquish the child to a commissioning parent who want parental responsibility. Traditional surrogacy, also indicated in literature as genetic surrogacy or partial surrogacy, is a process that mimics natural conception. Here, the surrogate mother is inseminated via intrauterine insemination or via in vitro fertilization. Gestational surrogacy, however, is a little bit more complex, with the embryo having no genetic resemblance to the surrogate mother. In both these situations, many methods can be used, with both gametes of both commissioning parents being used, both gametes being used from donors, or one gamete from a commissioning parent and one gamete from a donor. Because of these, there's a complex network of genetic ties with regards to the parent and the genetic offspring from surrogacy. Currently in Sri Lanka, there's a demand and a market for this method of assisted reproductive technology, especially due to the lack of provisions to acknowledge or regulate this practice in Sri Lanka. The pictures you see here are from online platforms that advertise surrogate mothers to both local and international commissioning parents. Our research was done to describe the attitudes and factors associated with surrogacy among 20 to 40-year-old general public in Colombo district, Sri Lanka. The study was conducted in Colombo district, Sri Lanka, and was a descriptive cross-sectional study. The study population comprised of men and women aged 20 to 40 years currently residing in Colombo district, Sri Lanka. The final calculated sample size of our study was 422. The sampling technique was a non-probability snowball sampling method, and the data collection was commenced via online self-administered questionnaire as a Google form. This was further divided into 4 subsections. Data analysis commenced via descriptive analysis as well as inferential analysis, which was performed using chi-square test and man-Whitney U test. Ethics approval was granted by the Ethics Review Committee of the Faculty of Medical Sciences, University of Sri Jayawardhanapura. The results of our study were as follows. The frequency distribution of the participants' attitudes towards the importance of the genetic link between the parent and the child revealed that respondents that agreed or strongly agreed on the importance of a genetic link between father and mother were both of equal percentages at 55.45%, while 43.39% disagreed or strongly disagreed that a physical resemblance to their child was important. Distribution of attitudes on the importance of the genetic link between the parents and offspring according to sociodemographic characteristics revealed a few significant factors. With regards to gender, it was observed that out of all of the male participants, a lesser proportion, which is 20%, had negative attitudes compared to the female participants of the study. The employed sector, 67% had positive attitudes with regards to this link between the parents and the child. When it came to religion, we observed that religion per se did not cause a statistically significant difference between the positive and negative attitudes regarding these genetic links, as Buddhist, non-Buddhist, and those of no religious beliefs all had relatively similar attitudes with regards to the genetic link. However, when it came to the level of religious beliefs, it was shown that those with more firm beliefs had relatively higher positive attitudes to the importance of the genetic link, with 84% of more firm believers having positive attitudes with regards to the importance of a genetic link between the children and the parents. A slightly lower percentage of positivity was shown towards traditional surrogacy by those who had positive attitudes with regards to the importance of the genetic link between the parents and the child, in comparison with its negative counterpart. The correlation between the attitudes of importance of the genetic link between parents and the child and attitudes on gestational surrogacy was also deduced as statistically significant. The need for genetic ties that links a parents to their children, in conclusion, played a significant role in the formation of attitudes both for and against surrogacy in general as well as between the two subsets of surrogacy, which is traditional and gestational. These are the references to our study, and with that, our research presentation has come to an end. Thank you very much.
I'm going to present the presentation, Patient Preferences of How They Wish to be Addressed in a Medical Consultation, a study from Sri Lanka. I'm Matthias A.T. and I'm the presenting author of the presentation, which also includes the authors UGA Dharani, G.K. Somatilaka, and S.B. Gunatilaka. In today's world, medical professionalism plays a huge role. When we talk about professionalism, doctor-patient communication is an integral component. Multiple factors influence doctor-patient communication. A good medical consultation always starts with the introduction of him or herself by the doctor to the patient. There is a paucity of data as to how best to address the patients in an Asian country. In Sri Lanka, doctors tend to address the patients most informally, addressing the patient as a family member. There is an inbuilt respect for elders, and there is an inherent closeness to one another in the Sri Lankan community. And hence, that might be the reason why most doctors prefer to call the patients informally, referring to them as Amma, Tata, etc. This study explores the way doctors address patients in an Asian cultural setting and the patient's expectations of a medical consultation. Moving on to the methodology, this study was a cross-sectional descriptive study carried out in the year 2020 at the Colombo South Teaching Hospital, one of the tertiary care hospitals in Sri Lanka. A total of 1,200 patients were selected, and the patients were asked questions about the medical consultation they had in hospital. In the study, we defined informal methods of address as mother, father, sister, and the formal methods of address as to the use of the first name, the last name, or titles. Moving on to the results, it's very interesting to note that out of 1,200 patients, 63.25%, that is more than half, reported that doctors never introduce themselves. And a large number, that is 97.91% of the patient reported that doctors never inquired how to address them. 93.66% reported that doctors have addressed them informally as mother, father, sister. And out of them, a 49.9% preferred being addressed informally, and 35.58% preferred to be addressed by their first name, 77% by their last name, and only 18% preferred to be addressed by their title. This graph shows the description of how the patients preferred to be addressed. Out of 1,059 patients who preferred being called Informally, 46.7% preferred being addressed the informal way, as they felt that it made the doctor-patient relationship more personal. 59.2% felt that the doctors treated them as their own relative when they addressed them informally. It is very interesting to note that the older female patients and married patients and patients of lower education and lower monthly income preferred to be addressed informally. And moving on to the conclusion, most doctors did not introduce themselves to patients, neither inquired how patients wished to be addressed. Social, cultural, ethnic, and other demographic factors can influence the preferred modes of address. It is not safe to assume that the patient can be addressed any way the doctor seems right, and it is always good practice to ask patients how they prefer to be called at the beginning of the consultation. And doctors should introduce themselves clearly to the patients, and the current rates of introduction are inadequate. Both of these components are essential in a better doctor-patient relationship. Thank you.
Presentation on factors that influence the decision to be an organ donor, a cross-sectional study done among undergraduate students of selected faculties of the State University of Sri Lanka. So as we all know, organ donation is currently a globally important aspect of the healthcare sector. Of the people who have end organ failures, their quality of life depends on organ donation. So in Sri Lanka, the most commonly transplanted organs include the cornea, the kidney, and the liver. So due to the importance of these donations, assessing the shortage between the knowledge and supply is of great importance. Also, understanding the factors which influence people to donate and attitudes of the people regarding these concepts is essential, as we can use these to plan promotional campaigns with regard to organ donation. So keeping these in mind, our general objective was to describe the factors which influence organ donation among undergraduate students of selected faculties of University of Sri Jagannathapura. So we used a descriptive cross-sectional study among 319 undergraduate students from 3 selected faculties, namely Faculty of Management Studies and Commerce, Applied Sciences, and Humanities and Social Sciences. So we used a pre-tested online questionnaire for data collection, and this was a self-administered questionnaire. So the attitudes with regard to organ donation was assessed using a Likert scale, and having a positive attitude was considered as an inclination towards organ donation. So a chi-square test was used to assess associated factors, and the p-value of less than 0.05 was taken as significant. So with regard to the results, in our study population, majority of the participants were female. 58.9% of the participants were Buddhists, and nearly 50% were from the Western province. So a higher percentage of Buddhists were willing to donate when compared with non-Buddhists, and this was a statistically significant association. Other positive factors which influenced organ donation included being a female and the absence of a chronic disease like asthma. Most of who were willing to donate believed that their family and friends also had a positive attitude towards organ donation. And with regard to people who had a monthly income of less than 50,000 rupees were willing to donate in exchange of money. And participants with adequate knowledge of the process of donation were also more likely to donate. So in our sample size, even though the ideal calculated sample size was 440, we only had 319 participants. So the response rate, therefore, was 72.5%. And this was an acceptable high rate of response. So such a high response eliminates a potential non-response bias. So the result obtained in this study is unfortunately not generalizable, because it is only applicable to the 3 faculties selected in the study, and also we only used undergraduate students. So information bias was minimized using a pre-tested standard questionnaire. So as this study evaluates the knowledge and attitudes of participants at the time of filling the questionnaire, there is no recall bias. So the students from Faculty of Applied Sciences had the highest level of knowledge. So maybe this was because they were studying and receiving education on subjects which were connected to biological sciences. And the Faculty of Management Studies and Commerce proved to have poor knowledge out of the 3 faculties. Among the participants of the study, majority of females had good knowledge, and this was similar to a study done in India as well. And with regard to the Western province, the residents had more knowledge compared to those who are not residing in Western province. And this was in keeping with the study in Saudi Arabia that describes rural respondents had a deficit in knowledge and attitudes about organ donation than urban respondents. In 2012, a national survey done in USA showed that 66% of students in college were willing to register as organ donors. So in our study, a higher percentage of the participants, 82.8%, were willing to register as organ donors. So out of which most came from Faculty of Management Studies and Commerce. And those who did not want to register were mainly from Faculty of Humanities and Social Sciences. Out of those who believed that this was a good deed, donating organs was a good deed, 72.9% were Buddhists. This could also be due to the fact that majority of the participants were in Sri Lanka are Buddhists. A study done among Indian dental students had demonstrated that Hindu and Muslim people's attitude towards organ donation was less positive than the ones who were belonging to other religions. So in other studies as well, it has shown that family and friends were also an important factor in becoming an organ donor. So, and also in our study it showed that participants with a lower family income were more likely to donate there were benefits such as money involved. So in conclusion, the factors which positively influence the decision to be an organ donor are being a female, Buddhist, absence of a chronic disease, positive influence of family and friends, good knowledge on organ donation, and a low family income. These are references. Thank you very much.
Hello to all of you. I'm Dr. Nazneen Nazir from the Postgraduate Institute of Medicine, University of Colombo. Today I'll be presenting to you our findings of a study that determined the diagnostic accuracy of the single version of the SNAP-4. Attention Deficit Hyperactive Disorder, or ADHD in short, is the most common behavioral disorder in children with cardinal symptoms of inattention, hyperactivity, and impulsivity. Its diagnosis requires symptoms to be present in 2 or more settings and are typically informed by parents and teachers, and therefore tends to be essentially subjective. That's where the rating scales come in and are therefore very important to arrive at a diagnosis in an objective way. SNAP-4 is such a scale that is used worldwide to screen for ADHD, comprising of 18 items structured in 3 subscales, and most importantly, available in a single version for both parents and teachers. It is also used widely in Sri Lanka in both clinical and research settings. However, its criterion validity has not been appraised to suit local context. Therefore, our objective was to determine the cutoff values for each subscale of a SNAP-4 and the overall scale for both parents and teacher ratings, as well as to assess its overall diagnostic performance. The SNAP-4 was initially translated to singular language by forward and backward method, following which it was culturally adapted by a modified Delphi technique with a 7-member panel of multidisciplinary experts. Thereafter, a descriptive cross-sectional study was conducted among single and medium state schools in Colombo district in primary school children aged 6 to 10 years. The primary caregivers and class teachers served as respondents. A total of 443 primary school children were selected randomly from 4 purposely selected schools. The criterion validity was appraised against clinical diagnosis of a consultant child and adolescent psychiatrist based on DSM-5 criteria. Receiver operating characteristic curves were computed to calculate cutoff values using both the urine index as well as the distance of least square method. Coming to results, the overall response rate was 90.3% for primary caregivers and 100% for teachers. The demographics of the study population revealed that they were largely males and were mainly 7 and 9-year-olds with a mean age of 7 and a standard deviation of 1.3 years. This slide here describes the ROC curves that were computed for all 3 subscales of the primary caregiver ratings. And the table here describes the summary statistics for all 3 curves. The high value of the area under the curve indicates the high discriminant ability of the test to differentiate between those with ADHD from those without. Similarly, high values were also obtained from class teacher ratings. The table here describes the indicators of diagnostic accuracy for different cutoff values for all subscales and for both raters. Coming to cutoff values, they were much lower for primary caregivers compared to the class teachers over all 3 scales, and together were much lower than values that were published in the literature, which were mostly from studies that were conducted in Western population. Similar lower ADHD scores were also obtained from Japanese and Chinese samples, as well as when other ADHD scales were administered in Chinese and Korean population, reflecting the highly sensitive nature of such ratings to cultural norms. The sensitivity specificity measure, the negative predictive value, and the likelihood ratios all showed satisfactory high values, indicating the highly informative nature of the validated scale. However, lower positive predictive values was common across scales for both raters. A plausible explanation to this is that for rare disease and disorders with a prevalence of less than 10%, as in the case of ADHD, the major determinant of positive predictive value is the prevalence of the preclinical disease of the population. So no matter how specific the scale is, if the population is at a relatively low risk of developing the disease, most of the results that are positive are false positive, which is reflected in the lower positive predictive values. Similar diagnostic performance was also apparent for overall SNAP-4 scores for both primary caregiver and class teachers. The reliability of the SNAP-4 scale was assessed with internal consistency and the test and retest reliability. Cronbach's alpha value ranging from 0.91 to 0.97 indicated very high internal consistency. Similarly, high values of correlation coefficient for all 3 subscales for both raters indicated high test-retest reliability. In conclusion, this singular version of the SNAP-4 parents-teacher scale demonstrated relatively high validity and reliability measures, emerging as a suitable tool to screen for ADHD among single and medium primary school children aged 6 to 10 years in Sri Lanka. Therefore, we recommend its use as a screening tool in school health programs to assess for ADHD at school level, and also in child gardens and psychiatric clinics in local hospitals, not only to identify, but also to monitor treatment outcome in children with ADHD. Thank you.
I'm Roshali Senaratna from University of Sri Jayawardhanapura. My study topic is, does hyperglycemia persist after organophosphate and carbamate cell poison? I will discuss under Introduction, Objective, Methodology, Results, Discussion, Conclusion, and Recommendations. First, we will move to the introduction. Organophosphate and carbamate are the commonest suicidal pesticides which are used in Southeast Asia. It has become a major health burden due to both acute and chronic exposure. The incidence of ingestion in Sri Lanka is reported as 10,000 to 20,000 hospital admissions per year. The highest incidence of poisoning in Sri Lanka is reported from Anuradhapura district. Organophosphate and carbamates are insecticides which are also toxic to mammals by inactivating acetylcholinesterase and leading to cholinergic clinical effects. Exposure to pesticides have considered as one of the contributory risk factors in development of diabetes mellitus in agrarian areas. When considered the chronic exposure, majority of the supporting evidences are from animal experiments and also several human studies. When we move to the acute exposure, biochemical changes like hyperglycemia, pancreatitis, and liver damage have observed due to acute exposure. Next, we'll move to the justification. Diabetes mellitus have observed in chronic exposure to organophosphate and carbamates. When we move to the acute exposure, there are limited studies worldwide and none from Sri Lanka. In these studies, they have observed hyperglycemia following acute exposure, but there was no any follow-up studies regard to these studies to assess persistent hyperglycemia. So the objectives were to assess the persistent hyperglycemia after 6 months of acute OP and carbamate poisoning and to assess correlations between on-admission severity of poisoning and glycemic status on admission and follow-up. Methodology. The study was carried out at Teaching Hospital Anuradhapura and this was a longitudinal prospective study. Patients at the age range of 18 to 60 years who were diagnosed with OP and carbamate poison at THA were included as the study population and the study size was 51. Ethical approval was obtained from these organizations before the study. And when we consider the inclusion criteria, age range from 18 to 60 years, patients who were diagnosed with OP and carbamate poisoning by the clinician according to standard diagnostic criteria, and patients who are admitted within 24 hours of ingestion were considered. Exclusion criteria were as poisoning with other toxic substances other than OP and carbamate, patients with previously known pancreatic disease, chronic liver disease, and diabetes mellitus. So, at the admission, blood sample was collected and from this blood sample, HbA1c, RBS, and RBC cholinesterase levels were assessed. And also, depending on the clinical symptoms on admission, Peradeniya organophosphate scale was assessed. Then after 6 months of poisoning, follow-up study was done. Blood sample was collected and from this blood sample, RBS and HbA1c levels were assessed. Finally, data analysis was done using SPSS version 21. Assessment of severity of poisoning was done according to two methods, RBC cholinesterase test method and POP scale. POP scale depends on 6 clinical symptoms: pupil size, respiratory rate, heart rate, fasciculation, level of consciousness and seizures. According to a scoring system, patients were categorized into 3 groups: mild, moderate, and severe poisoning groups. Let's move to the results. According to our results, among the study subjects, majority were males. It was 67% and majority have ingested carbamate. 47% was included in mild poisoning group, 49% was in moderate poisoning, and only 4% were included in severe poisoning group. Mean RBS level on admission and follow-up. As you can see in this graph, RBS level have significantly decreased in follow-up study. Mean RBS level on admission and follow-up according to POP severity groups. Significant difference was observed only regard to moderate poisoning group, but not in mild poisoning group. Mean HbA1c on admission and follow-up according to POP severity group. Significant mean differences were not observed between on admission and on follow-up HbA1c. Correlations between assessed parameters and severity of poisoning according to POP scale and RBC cholesterol. Only on admission RBS level showed significant correlations with severity of poisoning according to both POP and RBC cholesterol method. Discussion. Studies have observed an increased blood glucose level in acute exposure, which is consistent with our study finding, and also studies are not available to assess persistent hypoglycemia following acute OP and carb-med exposure except for one study. So the conclusions are persistent hypoglycemia is not observed following acute OP and carb-med poisoning. Significant correlation was observed between RBS on admission and severity of poisoning. So further studies with larger sample size and multiple study centers and future studies on more patients in severe poisoning group are recommended. These are my references. I would like to acknowledge University Grant for the financial assistance, and thank you.
Good morning, all of you. This presentation is about the replacement of artificial red colorants from lycopene of tomatoes for the well-being of human health. Background of the study: lycopene is a natural pigment, imparts red in color to the ripe tomatoes. Artificial coloring agents may not safe for the human health. Lycopene is also capable to act as an antioxidant, which can help to boost the positive health impact on humans. Lycopene is a natural food colorant, when you can use an alternative for the artificial colorant agents. The commercial products enriched with lycopene has a high demand, and also the tomato skin, seeds, and the pericarp tissues. These tissues contain more than 80% to 90% of the total lycopene of the tomato fruit. Isolation is the lycopene from tomatoes. We can use the method of supercritical fluid extraction in the extraction of the isolation and extraction of the lycopene from tomatoes. Value-added products that incorporating with the lycopene, we can develop these value-added products from the byproducts of the tomato-based industries. Considering the health benefits of the lycopene, research studies have revealed that lycopene exhibits the highest antioxidant properties and help in preventing the heart diseases and the cancer diseases in humans. Consider the reduction of the risk of cancer, mainly in the digestive tract, pancreas, and the bladder. Helps to prevent from the heart diseases by reducing the blood pressure and prevent the LDL cholesterol oxidation, and also the increase the plasma lycopene level have been associated with the reduction of the cardiovascular disease risk. Considering the objective of this study to determine the best post-harvest practices to improve the lycopene content in tomatoes, and also to find out the best methods to practice to isolate the lycopene from the ripe tomatoes, and to replace the artificial red colorants of selected food products by using this natural colorant of the lycopene. The study design carried out include that tomatoes belongs to the platinum variety were harvested from the 2 cultivation fields in Anuradhapura district at low maturity level, and 2 maturity levels named as the color birth stage and the fully ripened stage. And these samples were subject to determine the lycopene content after reached to the fully ripened stage. The tomatoes at color break stage were divided into two portions, and one was stored at the room temperature and other portion was stored in the cold room temperature until these samples become into the fully ripened stage. Then the solvent extraction method was used to extract the lycopene from these tomatoes, and the quantification of the extracted lycopene was carried out using the spectrophotometric method. These results revealed that the lycopene content was increased in high proportions in tomatoes. Those were harvested at color break stage and then kept in cold room temperature until becoming to the full ripened stage. The same variety of sample harvested at full ripening stage had less lycopene content than those samples harvested at color break stage and kept in cold room temperature. The samples harvested at color break stage and kept in room temperature had low level of lycopene than the samples kept in cold room temperature. By considering these two pictures mentioned below, the left-hand corner samples indicate that the samples harvested at color break stage and stored at room temperature for 7 days, and the other samples, red color samples, indicate that the samples harvested at color break stage and stored in the cold room temperature for 7 days. These two samples were harvested at same maturity stage, named as the color break stage, at the same day from the same field, from the same variety. But there is a considerable difference in the color. In the cold room temperature stored samples, there is a considerably high level of developed red color compared to the other room temperature stored samples. The lycopene is responsible for development of red color in the tomatoes. By considering these two photographs, we can say that cold room temperature stored sample has developed more lycopene than the room temperature stored samples. But get the clear idea of these results, then we go for the quantification of the lycopene that extracted from these two samples. This graph indicates that the taken results from the quantification of lycopene. The samples was drawn from the Kirolagam area in the Anuradhapura district. The samples at the harvesting at the fully ripened stage has less lycopene content than the other two samples that harvested from the color break stage and stored in room temperature and the cold room temperature. By considering the room temperature and cold room temperature stored samples, there is considerably high amount of developed lycopene was reported in the cold room temperature stored samples compared to the room temperature stored sample. The same results was given for the other area, that is samples stored from Talav area. It's a high amount of lycopene in the cold room temperature stored sample compared to the other two samples. Finally, we can conclude that low temperature storage enhances the lycopene development in tomatoes, and lycopene content is increased if they are harvested at color break stage and kept in low temperature storage until they become into the fully ripened stage. There was a big potential to extract lycopene from fully ripe tomatoes and to be used as a natural coloring agent to replace the artificial red colorants in selected food products. There is a high demand area. We can use this extracted lycopene used as a natural coloring agent. Thank you. These are the references used in this presentation. And thank you.
Greetings of the day. I am Ms. Randali Shinde from NMIMS University, India, is going to present a part of my project named Therapeutic Potential of Selenium Nanoparticles, which are aimed at inflammatory diseases. The PI of my project is Dr. Kritika Desai. So going ahead with the presentation, I'll be first talking about the background of this study. So the research focuses on synthesis of selenium nanoparticles, later coating it with methionine and folic acid. So why selenium nanoparticles? So firstly, inflammation. In inflammation, it is known that reactive oxygen species which are released can directly or indirectly cause DNA damage, which leads to tissue and cartilage damage. So antioxidants are known to control this reactive oxygen species and inhibit them. So selenium, acting as a cofactor for antioxidants, helps them to inhibit the reactive oxygen species. So selenium here plays two roles. Firstly, it can act as selenium-dependent peroxidases and reductases, which can directly reduce and inhibit the reactive oxygen species, or it plays a role like selenium-dependent repair protein, which can actually help in repairing the damage caused by oxidation. So the drawbacks of using selenium are its toxicity and bioavailability. So to overcome this drawbacks of bioavailability and toxicity, we are going to coat the selenium nanoparticles with methionine and folic acid. Why methionine? Because methionine is known to be essential amino acid, hence required by the body. Secondly, it has anti-inflammatory properties, plus it stimulates the cartilaginous tissues. Folic acid, because folic acid receptor beta is really and popularly known to be a target for inflamed cells, hence a promising target for anti-inflammatory therapies. Hence, selenium together with methionine and folic acid can give us selenium methionine folate nanoparticles. So going ahead with the synthesis method. So this is the method in which you can see it's a stepwise reduction method. So firstly, methionine is added, then folic acid is added, which gives us the final product, which is red in color. So characterization techniques involve UV and FTIR, which help us confirming the coating of methionine and folic acid on selenium nanoparticles. So the peaks observed in UV and infrared region help us confirming the same. Zeta potential at -60 millivolts help us to understand the stability of selenium nanoparticles. Then XRD was used to know the crystalline structure, and we were surprised to know that even after dual coating, the crystalline structure was maintained. ICP-AES technique is used to know the pure form of metal present, and here we wanted to know the pure form of selenium present in the final dual coated material, and we could find that 55% of pure selenium was present in selenium methionine folic acid nanoparticles. Raman spectroscopy helped us to know the trigonal nature of selenium. Going ahead with the characterization techniques, TEM was useful in knowing the spherical shape and 16 nanometer of size of selenium nanoparticles, and the coated selenium nanoparticles one also maintain the spherical nature of selenium with the bulk nature of the coating materials. Diffraction pattern helped us to know that the crystalline structure was maintained. Going ahead with the interaction studies are important because when a nanoparticle interacts with a living system, the interaction should take place, but at the same time, it shouldn't be a harmful interaction. So to prove this, we performed first interaction studies with DNA. Here, there are two bands formed. First is the nicked DNA and the second is a supercoiled band. Here, you can clearly see that there is less proportion of nicked DNA, and supercoiled region is comparatively way higher as compared to the controls. So you can say that the selenium at even at lowest concentration could protect the DNA over the oxidative buffer, whereas in control you can see the DNA had completely damaged. Going ahead with the protein interaction, UV and spectrophlorimeter was performed, and we could see that gradual reduction in the peak size with increase of nanoparticle concentration, whereas we performed CD so that to know the difference in the alpha helical structure as compared to the BSA controlled and with the BSA interacted with the selenium methionine folate nanoparticles. And we could find that 4% of difference was found out, which shows that there was an interaction with the protein, but simultaneously it shows that this concentration is not going to degrade the protein. So next we go ahead with the in vitro toxicity assay, also known as MTT assay. So we performed this assay on two cell lines, that is NIH383 and raw cell lines, and we could find out that around more than 50%, that is around 60% viability was observed for 100 microgram concentration at 72 hours of incubation for both the cell lines. The results were confirmed using AOEB staining method for 24 hours. In this method, the red cells are the dead cells and the green cells are the live cells. And we could see that around 80% of cell viability was observed for 24 hours, for 48 hours up to 80%, and for 72 hours up to 60% cell viability was observed. Going ahead with the applicative part, we found out that microgram per ml concentration of selenium methionine nanoparticles could reduce up to 50% DPPH inhibition. So this proves the antioxidant nature of selenium methionine folate nanoparticles, and which could go ahead and could be used as therapeutic agents for chronic inflammatory diseases. That's all for the presentation. These are my key references, my achievements. Thank you.
Erythromycin-loaded halocyte nanotube incorporated polymer-based electrospun skin scaffold for tissue engineering applications. Though this is a large topic, I will explain one by one how we have developed this skin scaffold. First, we will know what is skin scaffold. Skin scaffold is a novel burn wound dressing which is designed to improve wound healing process rather than dress the wound. It is an artificial extracellular matrix. It has three-dimensional nanofibrous structure. Nanofibers help to cellular attachment. 3D structure acts as barrier to microorganisms. It promotes cell adhesion and proliferation. Out of scaffold fabricating methods, I have used electrospinning technique. It is relatively simple instrument setup. It needs syringe pump, high voltage power supply, and grounded collector. A polymer solution generates nanofibers by application of strong electric field. In this study, laboratory-based erythromycin-loaded halocyte nanotube incorporated polymer-based electrospun skin scaffold have been fabricated, characterized, and evaluated for burn wounds. Then I will explain how I have fabricated and characterized the scaffold. First, erythromycin was loaded into the lumen space of the HNT by using standard vacuum evacuation process. To confirm the loading, FTIR studies and the drug entrapment efficiency were determined. UV-based drug entrapment efficiency was 29%. After that, we have determined most suitable polymer concentration by examining the electrospun images of different polymer concentrations. According to this microscopic image, you can see spiral and beaded fibers in low polymer concentrations. Both 9.5 and 9% gave non-beaded straight fibers, but 9.5% gave the finest and continuous straight fibers. Hence, we have selected 9.5 as the most suitable polymer concentration. Then the 5% weight by volume HNT and 2.5%, 5% and 7.5% weight by volume EHNT containing scaffolds were fabricated using electrospinning technique. After fabricating the scaffold, we have done characterization of synthesis materials. Cell adhesion of the final scaffold was analyzed. Cytotoxicity studies were done to observe viable cells, and also water absorption capacity and the antimicrobial action of the fabricated materials were evaluated. The chemical composition of the fabricated material were evaluated by FTIR studies. The release profile of erythromycin was analyzed for the composite with 7.5% EHNT in phosphate buffer saline. The erythromycin release from scaffold in different time intervals is given in this graph. The scaffold showed an initial burst release followed by a sustained release. According to our water absorption capacity study, scaffold showed 15-fold water absorption capacity, which is given in following figure. Microorganisms which can be commonly seen in burn wounds such as Bacillus subtilis, Staphylococcus aureus, Escherichia coli, and Pseudomonas aeruginosa were used to assay the antibacterial action of these materials. The disk diffusion method was used to assay. Antibacterial assay results are given in this table. Drug-loaded scaffold shows significant action and 7.5% weight by volume EHNT containing scaffold showed the highest activity than other low concentration of EHNT containing scaffolds. As illustrated in this FTIR spectra, characteristic peaks of erythromycin and HNT can be seen in EHNT composite. And also characteristic peaks of PCL and EHNT composite can be found in the spectra of final scaffold. Live and dead cell assay and cell adhesion was performed for cell-seeded scaffolds. We used Chinese hamster ovary cells for that study. Calcine and ethidium homodimer dyes were used to observe cells. The top surface of these scaffolds were observed using cell imaging fluorescence microscope. Calcine give green color for live cells. Ethidium homodimer 1 give red color for dead cells. Cell adhesion to scaffold is given in these fluorescence microscope images. At day 3, the good spreading of cells can be seen. Cells proliferated quickly and covered the scaffolds. Most of cells were penetrated into the mat. We used WSD salt to detect the viable cells. Human embryonic kidney cells were used to this assay. Viable cells convert WSD1 to pink color crystals, which give the absorbance. The absorbance was measured using spectrometer. Viable index of HNT is 80%, EHNT is 75%, scaffold with HNT is 95%, scaffold with EHNT is 85% compared to negative control. The finding of this study concluded fabricated non-toxic biodegradable scaffold is very advantageous novel dressing method on burn wounds. It absorbs large amount of exudates and permits sustainable drug release over the time with remarkable antimicrobial action. Thank you.
A good day to you all. I'm Aruni Gallage from Faculty of Medicine, University of Colombo. My presentation is about an online viva to assess the undergraduate research project to facilitate the continuity of teaching through the pandemic. COVID-19 pandemic has posed a significant challenge to all of us. Continuing medical education despite this situation is a challenge to medical teachers. The teaching and assessment modalities has to be adapted to face this new normal situation. Faculty of Medicine, University of Colombo, which was established in 1870, is the oldest medical faculty in Sri Lanka. The ability to conduct a health research successfully is one of the main outcomes of the faculty, which was achieved through the community stream undergraduate research module. The undergraduate research module for 2015 A-level intake was successfully completed prior to the pandemic. However, the viva voce examination to assess the undergraduate research was supposed to be held during the lockdown period. So, the aim of this viva was to explore the success of an online viva conducted via Zoom platform to assess the fourth-year undergraduate research project of the community stream of Faculty of Medicine, University of Colombo. There were 195 students of A-level 2015 batch, which were divided into 63 research groups. And the 63 hard copies of the research reports were handed over to examiners 1 month prior to the viva. The guidelines, the rules and regulations, and the SOPs were made and were conveyed to both examiners and to the students. A mock viva session was conducted to understand all the network-related issues and the underlying connectivity issues. A zip folder containing the mark sheets, attendance sheets, and the feedback forms were emailed to the examiners. A student WhatsApp group was formulated and maintained throughout the viva for instant communication. The viva was conducted via Zoom application in 4 consecutive days, 2 sessions per day by 16 panels of examiners. It was hosted by 2 academics, coordinated and operationalized centrally with the network backup from the University of Colombo. The host, the examiners, and the students were connected to each other in a virtual room. The students were assessed as a group but evaluated individually. This was the conduct of the Viva in a sample day. There were 2 sessions per day with 2 hosts, and one panel had 2 examiners. The 2 examiners had 4 research groups to examine, each consisting of 3 research students. At the time of the Viva, the 2 examiners and the 3 students were waiting in the waiting room separately. First, the examiners are invited to the room and then sent to the breakout room for 5 minutes to discuss about the research report. In the meantime, the students are invited to the room and a quick identification check was done. And at that time, a WhatsApp message was sent to the next group of students to be ready. The time duration for the Viva was 20 minutes, and the examiners took turns and adopted the flexible method in questioning the students. At the end of the Viva, when the students are dismissed, the examiners were given another 5 minutes to discuss about the marks. The result sheets and the comments were collected from the examiners under a password-protected email. The feedback forms were sent to students as a Google form to be filled voluntarily and anonymously and to be sent within a week. When we analyzed the results, we found out that the attendance for the Viva was 100%. It was fully adhered to the scheduled time. None of the sessions needed rescheduling. The response rate for the student feedback form was more than 90%. And you can see that 56% of students has logged in from the provinces other than the Western province. When we plotted the location in a map, we found out that the students are scattered all over Sri Lanka. And when we looked at the locations they have logged in, 93% has logged in from their homes, while the remaining 7% has logged in from relatives' places, friends' places, and neighbors' places. 49% has used smartphones to log into the Viva, while 31% has used desktop computers, and the remaining 20% has used tablet computers. 50% has used mobile broadband types, and 58% has used postpaid billing types. But only 20% has used Zoom educational packages to log in for the Viva. These are some screenshots we took when the Viva was going on. And none of the students, neither the examiners, got lost due to connectivity issues, other than for the minor voice breaks, which was resolved completely once the video was switched off. The signal strength and the audiovisual clarity was appropriate throughout. So we were able to overcome the perceived barriers to conduct an online Viva to assess a research, irrespective of the type of the device, irrespective of the district they have logged in, irrespective of the connectivity type. The online Viva was successful when adhered to a proper protocol and with adequate preparation. So in conclusion, an online Zoom meeting is a feasible option to conduct a Viva examination in this new normal situation. Thank you.
Good afternoon, everybody. My topic is possible role of migratory birds, wild birds, to coronavirus transmission to Sri Lanka. Here you can see one of wild birds from northern hemisphere, greater flamingo. Then coronavirus are widespread by several species of wild birds, but data on prevalence of coronavirus in wild birds across the world are scarce. This paper reviews the possibility of transmission of coronavirus to humans and other animals through migratory bird visiting to Sri Lanka. Here, under introduction, we humans cannot travel freely, but the birds are fortunate. They can do so without all the difficulty. These birds are mainly coming from other cold countries to feeding and breeding. Here, methodology, relevant data and information collected from reviewed papers, global and regional level. However, no scientific studies have been done locally to evaluate the reality of the problem in Sri Lanka. The bird species sampled in this study and the proportion of coronavirus positive samples mentioned in slide number 20 to 24. The species images collected past 3-year period. This is world migration primates from northern hemisphere to equator, and this is from Indian map. India map that is also primates. You can see Sri Lanka. Within the Sri Lanka, they fly to coastal belt, mid-country and southern part of Sri Lanka. Here discussion coronavirus are important pathogenic of birds and animals, including humans, and rare and are previously classified into 3 genera: alpha virus, alpha coronavirus, beta coronavirus, and gamma coronavirus. This coronavirus, it is possible to study using biology of avian coronaviruses in wildlife. Then this is also one of research papers, wild birds as reservoir in disease and abundant gamma and delta viruses. This paper is done and reveal the coronavirus and wildlife, wild bird studies. This is also same. And avian coronavirus in wild aquatic birds. This is so significant paper for the study of coronavirus from wild birds. And here, Gargani order, Vitro, Kellen, Flamingo, Vankale. These migrant birds are travel long distance from cold winter regions to warmer regions. Here, this is Ukrainian curlew also coming to Vitro, then Hollings gull and brown hair-headed gull, Pesale. You can see like this bird during the migratory period. Lesser crested tern, Urani Lagunaria returns mainly in Mana Island, northernmost area. Here you can see forest wagtail and grey wagtail birds in mid-country. This is also terns and gulls, mainly probably that wetland area, mainly mudflat area as well as mangrove areas. Here you can see osprey, bundler, and Indian blue river robin, that is hagala. Then from early August to April, there are 200 migratory birds coming to Sri Lanka. Sri Lanka being a tropical island with diverse ecosystem, that is the reason why are they coming. Here, number of migrants on our shores and wetlands is huge, where marked arrival places. This is very significant. This is Kumula and Nan area, that is the tank area. Here, this is the list of wild birds. You can see order family, common name, and specific name. Here, like this, it is possible to identify. Then potential avian influenza virus cases in India 2022 to 2021. I think these birds are entered to Sri Lanka during that migratory period. Conclusion and recommendation. No scientific data studies have been done locally to evaluate the reality of the problem, but certain countries, Finland, Denmark, Bangladesh, China, etc., have investigated the possibility of spreading coronavirus from native to wild birds and other animals population. Since it is prohibited to collect samples from migratory birds in Sri Lanka, relevant specific evidence should be collected from published evidence. Moreover, interspecies transmission poses great risk for spreading mutation and the emergence of new strains of the viruses. To recognize their contribution to evolving innovative viruses and diseases, region specific and outcome-based studies must be conducted immediately with continuous surveillance of the wild bird. I ask our medical doctors and medical students to undertake this untouched field. Here, this is the acknowledgement and this is the references. Thank you so much.